Hello, my name is Dr. Asha Pillai. I'm a GP in Hersham and also one of the lead GPs at North West Surrey Clinical Commissioning Group, who are responsible for buying and planning local health services. We have joined with our health and care partners to launch The Big Picture, a wide engagement campaign to talk to people about how we can improve local health and care services.
We have the model we have because of history and economics. It's up to us to rewrite the next chapter. So the challenge for today is to see what ideas we can come up with to design a system that's easy to access, that's trustworthy, and most of all meets people's needs on their terms, not on the terms of organisations.
We know staff work really hard to provide high quality care to our patients, but we also know that services aren't working as well as they could. For example, we want people to have more support to stay well, to make sure that they are seen in the most appropriate place for their needs, and reduce some of the burden on busy, urgent and emergency services.
It can be very difficult to actually find the care and the support in the community to keep that person out of hospital.
And we need to try and get people to work better together so that patients don't fall between two different organisations.
If we can prevent that, then they don't need A&E.
People tell us they find services confusing and it's difficult to get a GP appointment. This can mean they don't get the help they need until they reach crisis point, and as a result can end up in A&E and then need admitting to hospital. With the right initial support, for many people this could be avoided, keeping A&E for those who really need it.
It's starting from first principles. It's putting the patient or the member of the public, I don't just like the word patient, putting it at the centre of what we do and saying how can that person's needs be met by the professional services, yes, but in a more efficient, more cost-effective way.
There are a number of developments we are working on to improve support, things like GP extended access, creating thousands more appointments in the evenings and at weekends, online consultations 7 days a week, and a new NHS 111 service. We are also looking to develop more joined-up community teams to support groups of GP practices. These teams will include community nurses and therapists, doctors, and mental health and social care professionals, all working together to give patients with more complex needs the right support. We want to hear what you think about these developments and your experiences of local services. How else can we support people to stay well for longer and improve the experience for patients and carers? We have also been tasked by NHS England to implement new standards for walk-in services across North West Surrey. These urgent treatment centres will standardise walk-in and urgent care services and will be GP-led. They will be open at least 12 hours a day every day and be equipped to diagnose and deal with many of the most common ailments seen in A&E. There are significant differences between our existing walk-in facilities and the new specification, and we need to consider the best way to bridge that gap. Building on our conversations with local people, we will be drawing up proposals for urgent treatment centres. These may or may not require public consultation, depending on the level of change proposed. We will involve the public in the development of these plans and any decisions taken.